So we really appreciate you joining us for this special tonight. And I know you had your briefing this afternoon, and it looks like, our numbers have stabilized, as you said, although we have to remain cautious. I'm curious, we have half the population with at least one shot in them at this point. Are you encouraged by that number? Are we where we need to be?
I'm really encouraged by that number, Jen. You're right. We got 52% of our adults 16 and above have now had at least their first shot of vaccine. That's remarkable good news. All of our infections are generally in the younger cohort, probably the 20 to 30. So it's really important that young people get vaccinated. Don't hold off now. If we get them vaccinated over the course of the next couple of weeks, we're getting closer to herd immunity. I also love the fact that folks over the age of 70, over 80% of them got vaccinated. Remember a while ago, we wondered whether people would be shy or hesitant about getting vaccinated. Not that age group, they're getting vaccinated.
Yeah, that is so true. They're at that herd immunity number at this point. But as you said, we need the younger generation to get on board if we're going to achieve herd immunity for our entire population here in Connecticut. We've seen some of the high schools doing those pop-up clinics. What's the outreach been like on your end for teens in our state?
We're going to be bringing the vaccine to schools. We're going to be bringing the vaccine to colleges. We've had young people on TV telling their friends and friends of friends they got to do it. Young people getting vaccinated and posting on Facebook selfies. So we're doing everything we can to tell them it's the cool thing to do. It's the right thing to do for them and their family and their friends. And, I'd like to get the bars and nightclubs open, but we can't do it until we get more young people vaccinated.
I know you were showing earlier some of the efforts to get the young people vaccinated across the nation. Some of the headlines, including a shot for a shot. You get a shot at the bar if you get a shot of the vaccine, et cetera. Some of the ways that they're trying to outreach and get people to do that. All right, let's talk about the Johnson & Johnson manufacturing mess up, because that certainly put a big snag in a lot of states' plans. We've seen our doses drop off, as you've talked about, weekly. The Johnson & Johnson vaccine was going to be playing a part in vaccinating young people. You had talked about at the end of the month, we were going to see some of those high school clinics and some of the college clinics using Johnson & Johnson. So where does that stand right now?
Yeah, sadly, they had a manufacturing snafu down in Maryland, I think it was. So they've cut off the flow of J&J, or 90% of it, for Connecticut and every other state. J&J was pretty popular for young people in underserved communities and our mobile vans because it was one and done, one shot. But that said, we still are going to be able to do close to 200 vaccinations this week, mainly with Moderna and Pfizer, and the J&J going into the mobile vans. We're going to get there.
At the pace we're seeing, and this is the big question, right? When do you think Connecticut would be able to fully reopen, if you had to guess at this point?
I'd like to say that if people get vaccinated whenever it's available to them over the course of the next, 5-6 weeks, if we get to that 75% number, I think, by the end of May, we ought to be in pretty good shape. I got a couple of caveats there, though. One is we got these variants sneaking around New York and New Jersey. And if people aren't careful with the mask and get vaccinated, we could get a second hit. I mean, you see what's happening in Michigan and Idaho right now. I don't think that's going to happen in Connecticut. We're wearing the mask and we're going to get vaccinated.
All right, so you're thinking maybe end of May, if people go and get their vaccines, we could see fully reopening here. Several states have already dropped their mask mandates. Is that something that you would feel comfortable with at some point? And if so, what would that look like?
Well, remember, we've got 48% of our people haven't been vaccinated. And there are a fair number of people who maybe have a condition that will discourage them from getting vaccinated. So I think we're going to be very careful. I think when you're in close quarters indoors, we'll probably be wearing the mask a little bit longer.
Governor, looking back on the last year, I mean, this has been such a huge undertaking, and a total change from what you were planning on doing. I mean, we were talking tolls, we were talking marijuana, all that kind of stuff at the beginning of last year. And now this is pivoted. What has this been like for you in your position, having to make these decisions every day? And what have you learned?
I've learned that if you explain to people what you're doing and why you're doing it and how important it is, we get it right. And I love the people of Connecticut. Look, we were all flying blind, especially a year ago. We know a lot more now. But when it came to wearing the mask, we had to close things down, and we had to stay close to home for a period of time. When you couldn't necessarily see a loved one in the nursing home, it was really tough. And the people of Connecticut rallied, and here we are a year later with one of the lowest infection rates and one of the highest vaccination rates in the country. And that is what's cautiously allowing us to get back to a new normal. And I think it's so important. I care desperately for the kids in particular, Jen, because a lot of them haven't been in school for a year. We're going to try to do everything we can to make it up for them.
Yeah, almost everyone really impacted by this, even if you didn't become sick. From COVID, the isolation that happened, not being able to see others. It's been a long year. Governor Ned Lamont, really appreciate you taking time out of your day to come and talk with us for our special this evening.
Nice to see you, Jen. Be safe, everybody.
You as well.